It's that time of the year. Flowers are blooming, grass is growing. Don't we all look forward to the blue skies and warm sunny days of spring and summer? The thing is, millions of us don't find this as delightful and sometimes even dread this time of the year. The reason being hay fever. According to the NHS, 1 in 4 people in the UK suffer from hay fever, the non-stop sneezing, runny nose and watery eyes. Okay, you must be wondering, these symptoms are very similar to a cold or even COVID-19, so how do we distinguish them apart? First, despite what the name suggests, hay fever almost never presents with a fever. So if you do have a high temperature and muscle aches, it is likely to be a flu or COVID-19. On the other hand, if your symptoms are one or several of these, try recalling how long have you had them for. If the answer is a few days or a couple of weeks, it is likely to be a cold. But if the symptoms have been persistent over months, it is more likely to be hay fever. Or scientifically, the correct term is allergic rhinitis. What is allergic rhinitis? Rhinitis is the Greek term for inflammation of the nose, and allergic indicates it's caused by allergens. Most commonly, pet fur, dust, mold, and pollens. Because we are always in contact with such environmental allergens, hay fever, in fact, is an all-year-round problem. But the symptoms become worse during spring and summer, when the rising temperature not only provides us the warmth, but favors plants to bloom and reproduce by releasing their pollens into the air. Ragweed, birch, sagebrush. These are the common culprits that fill the air around us during spring and summer, causing hay fever. So, what brings about these unwanted hay fever reactions? The answer lies in your body. In some people, for reasons science is yet to explain, our body considers pollens as harmful intruders and triggers an immune response just like it would for bacteria and viruses. So, when we inhale, the pollens in the air trigger an army of cells that protects our body from harmful intruders to produce a molecule called histamine. This molecule is then responsible for bringing about the symptoms we see in hay fever. Experts have predicted that 50% of UK's population will suffer from hay fever by 2030. Now that we know what is hay fever and its symptoms, how can we treat it? Although in most cases hay fever doesn't pose a serious threat to health, almost everyone suffering from it admit that the symptoms are unpleasant and negatively impact their life quality. Over-the-counter medications such as antihistamines will be able to control the mild symptoms. In cases when this does not help to alleviate the symptoms, steroid nasal spray can be prescribed by your GP. Severe hay fever, however, can have a much more detrimental effect, especially if you suffer from asthma. Hay fever can trigger wheezing, leading to breathlessness. Prevention is better than cure, and it's especially true in this case. If you think you have hay fever, the first preventative step is to reduce exposure to allergens. For example, keep the windows closed and avoid going out when the pollen counts are high. You can do that by downloading weather apps such as Poncho, WebMD Allergy, and Weatherbug. If you do have to go out, consider wearing sunglasses and applying balm underneath your nostril to trap the pollens. Also, certainly remember to change your clothes, wash your hands and hair once you're back home. Consciously taking these measures can help us deal with the dreadful symptoms of hay fever and peacefully enjoy the spring and summer.